Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
What if a class of drugs designed for weight loss and diabetes management, held the key to longer survival for kidney transplant recipients? Well, that's exactly what we're diving into today. A groundbreaking new study published in the Lancet Diabetes Endocrinology that suggests glucagon-like peptide-1 receptor agonists,
Okay.
a class of drugs you might recognize by names like Ozempic and Wegovy, are showing incredible promise
Wow.
for kidney transplant recipients with type 2 diabetes.
What's so fascinating about this study is how it highlights the potential of these medications
Yeah.
in an area completely separate from their original intended use, managing diabetes and facilitating weight loss.
Like these medications had hidden talent,
Right.
and researchers just stumbled upon it.
Yeah.
Tell me, what exactly did this study look at?
Researchers at NYU Langone Health wanted to understand how glucagon-like peptide-1 receptor agonists were being used in a real-world setting. So they dove into a massive data set from the U.S. Renal data system, which contains information on almost every single kidney failure patient and transplant recipient in the U.S.
Wow.
They looked at records from over 18,000 kidney transplant recipients between 2013 and 2020.
Okay.
A pretty substantial sample size.
Wow. Talk about a deep dive.
Yeah.
So out of those 18,000 recipients, how many were actually prescribed glucagon-like peptide-1 receptor agonists?
Around 1,916 individuals received prescriptions for these medications.
Okay.
And what they found was truly remarkable.
Okay.
Kidney transplant recipients taking glucagon-like peptide-1 receptor agonists were 49% less likely to experience organ failure.
Wow.
Think about what that means for someone facing the prospect of dialysis again.
Right.
It could completely change their life.
That's incredible.
Yeah.
But also makes you wonder, how can something
Yeah.
so effective for weight loss and blood sugar control could have such a powerful impact on kidney health?
That's one of the questions researchers are still exploring.
Yeah.
While we know that these drugs help regulate blood sugar levels,
Promote weight loss and have positive effects on cardiovascular health.
Okay.
The exact mechanisms by which they protect the kidneys
Okay.
are still being investigated.
Got it.
It seems their benefits go beyond just weight loss and blood sugar control, which is what makes this so intriguing.
It's like these medications are holding on to a few secrets about how they work.
Yes.
But were there any concerns about potential side effects? I know there were some worries about glucagon-like peptide-1 receptor agonists
Right.
when they first gained popularity.
You're right, there were concerns.
Yeah.
Early on, there were worries about potential side effects, like inflammation of the pancreas,
Right?
liver problems, and even a possible link to thyroid cancer.
Oh, wow.
However, this study found no increased risk for these complications in the group using glucagon-like peptide-1 receptor agonists.
So it sounds like good news for those worried about those specific side effects, but I'm sure there's more to the story.
Yeah.
Were there any unexpected findings?
Actually, there was one.
Okay.
The study revealed a 49% higher chance of developing diabetic retinopathy,
Okay.
a condition that can damage the blood vessels at the back of the eye.
Hmm.
In the group treated with glucagon-like peptide-1 receptor agonists.
That's a significant finding.
Yeah.
Why would a drug that seems so beneficial in other ways have this effect on eye health?
Researchers believe this might be connected to how quickly blood sugar levels are corrected with these medications.
Okay.
You see, diabetic retinopathy can sometimes develop when blood sugar levels drop too rapidly.
Okay.
It's not the lower blood sugar itself that's the problem,
Okay.
but the speed at which it changes.
So it's like a double-edged sword.
Right.
The rapid improvement in blood sugar that these medications can bring about
Right.
might also be contributing to this eye complication.
Precisely. It highlights the importance of personalized medicine
Okay.
and careful monitoring.
Right.
Doctors need to keep a close eye on the eye health of kidney transplant recipients taking these drugs.
Early detection and management of any eye issues are crucial.
That makes a lot of sense.
Yeah.
It sounds like a classic case of weighing the risks and benefits.
Yeah.
So overall, what would you say are the biggest takeaways from this study for our listener?
This study provides compelling evidence
Huh?
that glucagon-like peptide-1 receptor agonists could be game changers for kidney transplant recipients with type 2 diabetes. They might not only extend their lives, but also protect their transplanted organs.
Right.
However, it's crucial to remember that this is not a one-size-fits-all solution.
Okay.
While the potential benefits are exciting, we also need to be aware of the potential risks, like the increased chance of developing diabetic retinopathy.
Right.
It emphasizes the need for personalized care, regular eye exams,
Got it.
and close monitoring by healthcare professionals.
It's a reminder that no two patients are alike, and what works for one person might not work for another.
Right.
So how are these medications being used in the real world? Did the study reveal anything interesting about the timing of prescriptions after a transplant?
Yes, it did.
Okay.
The researchers found that the median time between a kidney transplant and the first prescription for a glucagon-like peptide 1 receptor agonist was 19 months.
Oh,
Keep in mind, that's just a median,
Yeah.
meaning half the individuals started sooner and half started later.
So there's some variability, which is understandable given that everyone's journey after a transplant is different.
Absolutely. What's interesting is that a significant portion of recipients,
Okay.
around 39%, received their first prescription within 6 months of their transplant.
Wow.
This suggests that doctors are becoming more comfortable integrating these drugs into early post-transplant care, which aligns with the growing evidence that early intervention in diabetes management can have a positive impact on long-term outcomes.
It's like they're recognizing the potential of these medications
Yeah.
to not just manage diabetes,
Yeah.
but also potentially improve the odds of the transplant being successful in the long run.
Precisely.
Yeah.
But we have to acknowledge that these are still relatively new medications.
Yeah.
And as we've discussed, there are potential risks to consider.
Right.
Healthcare providers need to carefully weigh the potential benefits against the risks for each patient.
Yeah.
Factors like age, overall health, and the presence of other medical conditions all come into play.
It's a complex decision-making process.
It is.
And it underscores why having a strong relationship with your healthcare provider is so important.
Absolutely.
So moving on, another fascinating aspect of the study was the breakdown of which glucagon-like peptide 1 receptor agonists
Okay.
were most frequently prescribed.
Okay.
It gives us a glimpse into real-world prescribing patterns.
Right.
I've been curious about that. We mentioned some popular brand names earlier,
Yeah.
but I imagine some might be more common than others in this specific context.
You're right. The study found that Dulaglutide, also known as Trulicity, was the most frequently prescribed glucagon-like peptide 1 receptor agonist, accounting for almost half of all prescriptions in 2020.
Interesting. Any theories on why that particular drug was the go-to choice?
Well, the study didn't delve into the reasons behind this preference.
Okay.
One possibility is that Trulicity is a once-weekly injection, which can be more convenient for patients compared to daily injections.
That makes a lot of sense. Sticking to a medication regimen can be challenging.
Yeah,
So anything that simplifies it is a win for both patients and doctors.
exactly. And it's important to note that prescribing patterns can evolve.
Okay.
As new medications become available and more data emerges about their effectiveness and safety, the landscape of glucagon-like peptide 1 receptor agonists could look quite different in the future.
It's a rapidly evolving field.
It is.
And it's exciting to see how these medications might continue to reshape the way we approach diabetes management and post-transplant care.
Right.
Speaking of reshaping, this study has sparked a lot of discussion about the potential implications
Right.
of glucagon-like peptide 1 receptor agonists beyond kidney transplantation.
Yeah.
What are your thoughts on that?
It's a fascinating area to consider.
Yeah.
This research raises important questions about the broader applicability of these medications.
Oh, yeah.
Could they be valuable tools for managing diabetes and improving overall health outcomes in the general population,
Okay.
not just transplant recipients?
It's certainly a tantalizing possibility.
It is.
We know these drugs can help regulate blood sugar,
Uh-huh.
encourage weight loss, and even have a positive impact on cardiovascular health.
Yeah.
So it's not a huge leap to imagine that their benefits could extend to a wider group of people.
Exactly. There are already ongoing studies investigating the use of glucagon-like peptide 1 receptor agonists
Okay.
for various conditions, including heart failure, non-alcoholic fatty liver disease,
Okay.
and even Alzheimer's disease.
That's a really diverse range of potential applications.
Right.
It seems like these medications could be on the cusp of transforming how we approach a number of chronic health conditions.
It's a very exciting time to be in medical research.
Yeah.
The discoveries we're witnessing with glucagon-like peptide-1 receptor agonists are a testament to the incredible progress being made.
Right.
But as with any new frontier,
Yeah.
it's important to proceed with a balance of enthusiasm and caution.
It's like walking a tightrope
Yeah,
between hope and realism.
exactly.
We need to embrace the potential while being mindful of the need for thorough research and personalized care.
Right.
Speaking of research, let's dive a little deeper into how this particular study was conducted.
Okay.
The methodology behind any research is crucial to understanding its strengths and limitations.
Absolutely. In this case, the researchers tapped into a truly remarkable resource,
Okay.
the U.S. Renal Data System, or USRDS.
Okay.
This system compiles data on virtually all kidney failure patients and transplant recipients in the United States, giving researchers a comprehensive view of these patients' journeys from diagnosis to post-transplant care.
It sounds like an incredibly valuable tool for this type of research.
It is.
What kind of information did it give them access to?
They were able to analyze not only medical records, but also data from the Organ Procurement and Transplantation Network and even Medicare claims.
Wow.
Having access to such detailed information helped them control for potential biases and ensure the accuracy of their findings.
It's like having multiple lenses to view the same picture.
Right.
Each piece of information adds depth and clarity to the overall understanding.
Precisely. However, even with such a robust approach,
Yeah.
every research study has its limitations.
Right.
And it's essential to understand those limitations
Yeah.
so we can interpret the findings appropriately.
Transparency is key in any scientific endeavor.
It is.
So what were some of the limitations the researchers themselves pointed out?
One key limitation they acknowledged was the possibility of residual confounding, meaning there might be other factors that could explain the observed results,
Good.
even after they tried to control for them.
Could you give us an example of what that might look like in this context?
Certainly. For instance, individuals prescribed these medications might be more health conscious overall.
Okay.
They might be more likely to exercise regularly,
Okay.
eat a healthy diet,
Yeah.
or be diligent about taking their other medications.
Okay.
So those healthy habits, rather than the drugs themselves,
Right.
could potentially be contributing to the positive outcomes.
It's like trying to isolate a single variable in a complex equation.
Right,
There are always other factors that could be influencing the results.
exactly. The researchers acknowledged this as a limitation,
Right.
but they did their best to minimize the impact of confounding by using statistical techniques to adjust the data and make the groups being compared more similar.
Like they were trying to level the playing field statistically
Right.
to get a clearer picture of the medication's true effects. Were there any other limitations they mentioned?
Yes.
Okay.
Another limitation they highlighted was that their study focused specifically on patients with Medicare as their primary insurance.
Okay.
So the results might not be generalizable to younger individuals or those with different types of health insurance.
That's an important point to keep in mind.
Yeah.
It means we need more research to see if the benefits observed in this study hold true for other populations.
Precisely. But even with these limitations,
Yeah.
the study provides valuable insights and adds to the growing body of evidence,
Right.
suggesting that glucagon-like peptide-1 receptor agonists
Right.
hold significant promise for improving outcomes for kidney transplant recipients with type 2 diabetes.
It's a story of potential, discovery, and the ongoing quest for better treatments and a deeper understanding of how our bodies work.
It is.
But I think it's time we wrap up this part of our deep dive and give our listener a moment to absorb all this information. Welcome back to our deep dive into the world of glucagon-like peptide-1 receptor agonists and their potential impact on kidney transplant recipients with type 2 diabetes.
Yeah, it's been quite a journey exploring the fascinating findings of this study and the broader implications of this research.
Right, we've covered a lot of ground, but before we wrap up, it's crucial to circle back to a point you made earlier, the limitations of any scientific study.
Absolutely. Being aware of the limitations helps us interpret the findings accurately
Right.
and understand the boundaries of what we can conclude from the data.
So what are some of the limitations that the researchers themselves highlighted in this study?
One key limitation they acknowledged was the lack of detailed information about the specific causes of graft failure.
Okay.
While they observed a significant reduction in graft loss among those taking glucagon-like peptide 1 receptor agonists,
Yeah,
they couldn't pinpoint exactly why those grafts failed in some cases.
that makes sense. It's like seeing the positive outcome, fewer graft failures.
Right.
But not having all the pieces of the puzzle to understand the full picture of why.
Exactly. It's possible that certain causes of graft failure might be more responsive to these drugs than others.
Okay.
Further research is needed to explore those nuances.
So there are still unanswered questions and avenues for further investigation.
Right.
What else did the researchers point out as a limitation?
Another limitation they mentioned was that they didn't directly compare the effectiveness of glucagon-like peptide 1 receptor agonists
Okay.
to another class of diabetes medications called sodium glucose cotransporter 2 inhibitors.
Ah, yes. Those medications have also been generating a lot of buzz in the diabetes world,
Right.
especially for individuals with kidney disease.
They have, and there's growing interest in understanding how glucagon-like peptide 1 receptor agonists compare to sodium glucose cotransporter 2 inhibitors
Okay.
in terms of both effectiveness and safety for kidney transplant recipients.
So while this study showed promising results for glucagon-like peptide 1 receptor agonists, it's possible that sodium glucose cotransporter 2 inhibitors might offer similar or even better outcomes for this specific patient group.
That's right. We need head-to-head clinical trials
Okay.
to compare these two classes of medications directly and determine which one might be superior for kidney transplant recipients.
Okay.
It's an area ripe for further research.
It sounds like the world of diabetes management and kidney transplantation is constantly evolving,
It is.
with new discoveries and potential treatments emerging all the time.
Right.
It is a testament to the power of scientific inquiry to challenge assumptions and uncover possibilities that we might not have even imagined before.
Yeah, and remember, we started this deep dive by posing the question, could a class of drugs designed for weight loss hold the key to longer survival for kidney transplant recipients?
And based on this compelling research, the answer seems to be leaning towards a hopeful yes.
However, as with any medical advancement, it's vital to approach it with both enthusiasm and a healthy dose of caution.
Right? We need to embrace the potential while acknowledging the need for personalized care and ongoing research.
This study serves as a reminder that the journey of scientific discovery is never truly over.
Right.
It's a continuous process of exploration, refinement, and a relentless pursuit of knowledge.
So what does all this mean for our listener? What's the takeaway message they can carry with them from this deep dive?
If you or someone you care about is a kidney transplant recipient with type 2 diabetes, this research offers a glimmer of hope
Okay.
and a potential avenue for improving health outcomes.
Right.
Talk to your healthcare provider about glucagon-like peptide 1 receptor agonists
Okay.
and discuss whether they might be a suitable option for your individual circumstances.
Remember, personalized medicine is all about tailoring treatment plans to the unique needs and characteristics of each patient.
And as new research emerges, stay informed,
Okay.
engage in conversations with your healthcare team, and advocate for your health. It's a partnership, after all.
This deep dive has been a testament to the remarkable advancements in medical science and the power of research to transform lives. And as we conclude this episode, we leave you with this thought.
Never underestimate the power of asking questions,
Right.
seeking knowledge, and remaining curious about the world around us.
Yeah.
It's through that curiosity that we unlock new possibilities and pave the way for a brighter future for everyone.
Thank you for joining us on this episode of The Deep Dive. We'll see you next time.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.